7 years after it became law, the Affordable Care Act, also known as Obamacare, remains a polarizing force in American politics. As Adam Riley continues his look at the issues in the presidential campaign, he found the candidates' positions to be dramatically different on health care.
You've got this crazy system.
When Bill Clinton dissed Obamacare this week, he didn't just mock a policy Republicans love to hate. He ripped a law his own wife has vowed to defend.
That is one of the greatest accomplishments of President Obama, of the Democratic Party, and of our country.
Not that Hillary Clinton thinks Obamacare is a panacea. She says more people still need affordable care, so she'd expand Medicare and create a new government-run insurance plan, the so-called public option. She's also vowed to rein in copays, deductibles, and drug costs, saying they're growing too fast. Still, the ACA is her foundation, and MIT economist Jonathan Gruber says that's a good thing.
We've covered 20 million people with health insurance.
You might expect that endorsement since Gruber helped design Obamacare, but he says it's really working.
Healthcare costs have grown more slowly since the passage of the Affordable Care Act than in any period in measured history in our nation.
Ask Donald Trump, though, and Obamacare has been a disaster.
We are going to replace Obamacare with something so much better.
A full repeal is the first item on Trump's healthcare to-do list. He's also promising a bevy of free market reforms, like expanding health savings accounts, letting health insurers sell across state lines, and requiring price transparency so people shop for the best healthcare deals. But for some on the right, Trump has a credibility issue.
He doesn't seem to have any interest in health care.
For the record, the Cato Institute's Michael Cannon agrees with Trump that Obamacare should be repealed and replaced with health savings accounts.
If you expand health savings accounts in the right way, you can drive prices, healthcare prices, downward.
But Cannon also says Trump has been troublingly inconsistent, from proposing reforms that are already law to suggesting that more government control, not less, is the way to go.
I am going to take care of everybody. Who pays for it? The government's going to pay for it.
Add it all up, Cannon says, and
You don't have any idea where he's going to go. He could repeal Obamacare, or he could decide he's going to get us a great deal on a single-payer healthcare system and get Republicans to go along with that.
Still, if you don't like the ACA, Trump is probably your best bet, because Bill Clinton isn't on the ballot.
It's the craziest thing in the world.
Adam Riley joins me now.
It never gets old.
Good to see. So Jonathan Gruber is not only the guy who also helped with Romney Care,
Yep.
but he's the guy who unfortunately was caught saying that Obamacare was written in such a way to do an end round around, I think he said around the stupidity of the American voter. That's him, right?
That same guy.
Yes,
yeah, I mean, the argument was essentially voters wouldn't like it if they knew what was in it,
Right.
so it had to be written in a way that would keep them in the dark. He got really quiet after that, caused the huge backlash that we both remember. I think he's reemerging now in part because it's blown over, and in part because his legacy is on the line here. He wants to sell people on the law in a way he didn't back before.
Okay, in the spirit of fairness, which we've embraced here, Jill Stein and Gary Johnson. Gary Johnson is not saying, like he's saying about foreign policy, it's an asset to be ignorant about foreign policy, which he did literally say yesterday.
He is not saying that, but he's taken a pretty extreme stance. He wants radical privatization, not just the repeal of Obamacare, but essentially the elimination of health insurance except for catastrophic illnesses. If you need to have your gallbladder out, for example, and this is an actual Gary Johnson quote, he wants you going to Gallbladders Are Us, taking your own money and going down the street to get the procedure done.
How about Jill Stein?
Jill Stein is just like Bernie Sanders, single-payer health care, just like Canada. So if you like Bernie Sanders on health care, you might want to check her out.
Adam Riley, thanks. These are great,
Thanks,
really important. I really appreciate you doing them, Adam Riley.